So the first thing is a stockinette, and it's kind of like the underwear. Next, we're going to wrap the fingers. And we have to wrap fingers because what we're trying to achieve here is a gradient pressure. So you have to have more layers, not pressure, on the fingers than you do on the rest of the arm. So please don't wear rings when you are being wrapped. You also want to make sure that you don't really attempt doing this without being taught by a professional. And you also do not want to use ACE wraps for the wraps for lymphedema. You know how ACE wraps will tighten up when you use those on an extremity, and you end up having to take them off because they're hurting you. These particular wraps that we use are what we call short stretch bandages, and they do not tighten up like ACE wraps do. So we'll finish up this last 2 fingers and then we'll move on to the rest of the wrap. When we're wrapping, we try to make sure we don't get any wrinkles because the wrinkles can actually cause pain. And you also want to make sure that you're getting up into the webs, because if you don't get those webs wrapped in there, you actually can get swelling just in the web of your fingers. And when you come around that wrist every time, you always want to make sure it's loose because we don't want to get any constriction in the wrist area. So if you want to try and get rid of the butterfly, the little flags here, I think is what we call those, you can actually come back up, wrap around, get that like that. See if we got enough to do this last one. There we go. There you are. Now we're going to pull the stockinette down and put it over the thumb. Next comes Artiflex padding, because you can end up getting pressure areas in here. And also, Kathy, can you hand me those? Some people, if they have a lot of swelling, we may end up using foam. So these are thin pieces of foam that have been put inside stockinette and actually could just slide right onto the extremity like that. And then this section would actually be for the lower arm. And then we would wrap that in too. But for Kathy, we're just going to do the cotton swathing or Artiflex. If there is a lot of swelling in the top of the hand, I actually would end up putting several layers over that. I'm going to turn this up so it's kind of out of the... So I would put several layers over the top of that hand to provide extra padding there. And then we wrap on up the arm. And I'm not pulling this, but I am making sure that it conforms to the arm really well. And we want to make sure there's no pressure areas here, so we'll actually put a couple of extra layers there, and then we work on it. And since we've got so much left, there, I'm going to run it on down. So now we're going to put on the third bandage, and because we are up near the elbow, there is sometimes a problem with irritation occurring right here because people are always bending that elbow because you can't, I do expect you to use it. So I'm going to angle it up. We're going to go around once, and I'm actually going to go up over the elbow, around, and come back down like this, and that makes a nice little X there so you don't get the edge of the bandage cutting into that elbow. And then we just continue on up. And this is going to be quite wide because I want to make sure this one gets all the way up to the top of her arm. And I'm not pulling, but I am rubbing this around to make sure that it conforms to her arm. There we go. All right. And then the last bandage is going to go from the wrist all the way up. So angling it up. And the overlap here is going to be about half the width of the bandage. And again, conforming to the arm. There you go. And then this normally takes 2 pieces of tape to do this last one because this isn't going to stay on. I'm only going to tape with one. But now the important part here, remember I said we needed a gradient pressure? So I want to squeeze her arm all the way up. And I make sure that it is firmer here than it is here, and that this is firmer than here, and this is firmer than here. And see, Kathy's nodding. Yes, indeed, that is the case. If you wrap and you find that it's tighter here and softer here, just take one of your bandages and add just one layer between here and here. That's going to then make it a gradient pressure like we're trying to achieve. If there is swelling in the arm and you put this on, it actually feels comfortable.
It's very comfortable.
And I think Kathy will tell you that as well because she's been dealing with lymphedema for 10 years, 12 years, 13 years. That's wrapping the extremity.